Welcome to NSG 227, Study Session 7, Collecting Specimen from Nose and Throat. Introduction. One means of gathering information about the patient's health status is by identifying pathogens present in the body. You will therefore examine how to obtain specimen from the nose and throat in this study session. Learning outcomes. When you have studied this session, you should be able to 1. Assess a client and make a nursing diagnosis of a client for this procedure. 2. Set the articles needed for this procedure. 3. Collect specimen from the nose and throat. 4. Collect sputum specimen. 5. Collect sputum specimen by suctioning. Assessment and nursing diagnosis. Assessment. Determine client's understanding of the purpose and method of taking the culture sample. Rationale. Determines the type of nursing teaching necessary. 2. Examine condition of the area from which the culture sample is to be taken for redness, swelling, drainage or exudate, nasal congestion or evidence of bleeding. Rationale. Indicate signs and symptoms of inflammation or infection present in the nasopharyngeal mucosa. When present, culture sample is directed at the affected area. 3. Observe the client for signs of anxiety about the culture. Rationale. Indicate nursing measures necessary to relieve anxiety. Nursing diagnosis. 1. Health-seeking behaviors related to knowledge deficit of purpose of culture. 2. Anxiety related to impending culture. 3. Pain related to mucosal irritation. Objectives. The client's nose and throat swabs will be taken without discomfort or bleeding, as evidenced by his or her reports and inspection. 2. Clients will accurately report the reason for the culture and explain when and how the results will be learned. Articles. Articles needed are requirements and use. 1. Sterile cotton tipped swab or applicator in a culture tube. Removes exudates from pharyngeal mucosa without contamination. 2. Sterile flexible wire swab in culture tube. Removes exudates from nasal mucosa without contamination. 3. Tongue depressor. Depresses the tongue for better visualization of the pharynx. 4. Pen light. Illuminate area to be cultured. 5. Facial tissue. For use if there is excessive tearing or coughing following culture. 6. Identification labels. Prevent errors by correctly labeling. 7. Laboratory requisition. 8. Emesis basin, in case client gags and vomits. Collecting specimen from the nose and throat. Step-by-step technique. Nursing action and rationale. 1. Explain the procedure to the client. Inform client that a tickling sensation in the throat may be felt. Informs the client and encourages discussion of anxiety or discomfort. Prepares for the discomfort of the culture. 2. Wash hands. Limit transfer of microorganisms. 3. Instruct the client to sit upright or help into that position. Allows easier visualization of the access to the pharynx. 4. Place tissue and emesis basin within client's reach. Prepares the client if either is needed. 5. Ready the swab by loosening it from the culture tube. Place it within reach. prepares the swab. 6. Instructs the client to tilt head back and open mouth. Permits visualization of the pharynx so that it can be inspected. 7. Explain the procedure to the client. Inform client that a tickling sensation in the throat may be felt. Prevent contamination of the swab tip. Evaluation. Determine if the objectives have been met by assessing for client's ability to accurately report reason for culture. Client reports that nose and throat are without discomfort, and inspection confirms no bleeding from culture. Documentation. Documentation date, time of taking the specimen. Documentation on usual response from the client. Nursing action and rationale. 1. Explain procedure and rationale to the client. Encourages participation. 2. Have clients rinse mouth before coughing to move oral contaminants. 3. Don gloves and position clients in upright, high fowlers dangling or standing. Place clients in an optimal position to fully expand the lungs and forcefully expel air and secretions. Collecting sputum by suctioning. Nursing action and rationale. 1. Place clients in high fowlers position. Placing clients in an optimal position 2. 2. Connect tubing from the suction device to the collection trap. Fully expand the lungs and forcefully expel air and secretions. 3. Open the sterile saline bottle. Ensures maintenance of asepsis. 4. Open sterile suction kit using sterile technique. Ensures maintenance of asepsis using ungloved hand. 5. Put sterile gloves on the dominant hand. Facilitates handling and directing the catheter into the airways. Evaluation. Evaluate if the expected outcome has been achieved by assessing for adequate amount of sputum has been collected by client's deep coughing, client's respiratory rate and quality are within normal limits for age and usual respiratory status. Documentation. Document date, time of taking the specimen. 2. Describe appearance, quality, and other relevant characteristics of the sputum. 3. Document client's response to the procedure. Study session summary. In this study session, you learned how to assess a client and make a nursing diagnosis of a client from whom to collect specimen from nose and throat. You also studied how to collect specimen from the nose and throat. End of study session 7. Thanks for listening.